components of connective tissue. So this is the definition for inflammation. Then about the description, inflammation will be described as redness of skin, swelling, and temperature is high. For the mediator, there is a general definition like chemical mediators, substances that trigger certain process in an inflammatory reaction. Then the second one is it is related to the origin. Mediators related to the origins are necrotic or cell-derived mediators like histamines, serotonins, etc. And plasma-derived mediators are activated by necrosis, then complement system and C-reactive proteins.
So, about inflammation, you described it as an adaptive and regenerative process. But why do we sometimes consider it pathological? And why do we sometimes treat inflammation itself? How can it damage an organism or its parts?
Inflammation can be done the question for inflammation was how it is pathologically done. So the bradykinins and histamines are involved in inflammation. Whenever there is a high inflammatory part, the the more blood is collecting over the affected part, and it is basically to kill the microorganisms or pathological conditions of the organ.
Those all are adaptive reactions that are directed on the recovery. How does accumulation of blood in tissue damage it or damage other tissues? I don't quite understand. The blood is the best liquid in an organism. Any tissue will be glad to have more blood.
Yes, but it is the pathological condition, and in inflammation, the temperature is high. The microorganisms will, but obvious they will die due to the high temperature. So it is bacteriostatic. And about the blood, why it is collecting more? Because it is affected part. And also the acidosis also increases due to the inflammation.
Inflammation leads to local acidosis, and acidosis, as we know, is a damaging factor.
Yes.
The first type of pathological influence. More than that, inflammation itself, with its increased size, can compress the neighboring regions, the neighboring tissues, and compression is a damaging factor. Next, the necrosis and those mediators and those signaling that you named damages the surrounding regions and stops circulation, and because of that there can be circulatory damage, circulatory failure, and circulatory damage to the regions that are neighboring the site of inflammation. And because of that, sometimes we call inflammation a pathological process, and sometimes we need to treat it with anti-inflammatory
Treat it
treatment.
with the anti-inflammatory drugs.
Sometimes we even need to use anti-inflammatory drugs.
Even surgery is also done if the pus formation is there or abscess is there. It is a kind of inflammation. So surgery is very important in the inflammation. It is a part of necrosis, lung abscess.
And this continuing pus formation also accumulates toxins and accumulates damaging factors. As for the main signs of inflammation that you listed, redness, increase in size, increase of local temperature, pain, and loss of function. What is the pathogenesis? How are these signs formed? Please describe them more specifically. For example, redness. Why
Redness
does
because
it
of blood accumulation, more blood accumulation in the portion where the inflammation is happening. Then
hemoglobin has red color, so redness is due to accumulation of hemoglobin, of blood. Next, increase in size. How does it happen?
is due to the swelling of the basic thing is macrophages are attacking the bacteria, and that's why the pus formation is there. Even the interstitial tissue, fluid is also accumulating, so there is a swelling, so the size increases, and inflammation also rises temperature. So basically it is like hot in the area, affected area.
As for increase in size, yes, the main part of it is swelling, is accumulation of fluid. As for temperature, from where does this excessive heat enter the inflammatory area?
Because of the prostaglandins.
Prostaglandins themselves do not contain heat and do not produce heat.
but,
So
but
the
they help in increase the temperature.
focus of inflammation is usually more hot than the other tissues and even than the blood. So the heat is generated locally on the site.
Yeah, even the immune systems, they are immune cells, they are attacking the bacteria. So there is a temperature, rise in temperature in the specific area. The reaction between them is rising the temperature of the affected area.
So usually it is not a result of intracellular interactions or intercellular interactions. Heat generation is chemical because of proteolytic enzymes working. They are catabolytic ferments, and of course any catabolism, any destruction of molecules, any reduction of size of molecules results in generation of heat. Those are the main signs of inflammation and how they are formed. Okay, it's enough as for an answer. We have your presence on all of the lessons and even some participation in discussions on the topics.
Will you please tell me the marks?
As for mark, Such an answer usually would result in 4, but as you participated in our discussions on more than one occasion, then we should slightly increase the mark to 5 minus for you.
Okay, doctor.
Okay, next you will be choosing a question for Zaid. Zaid,
Yes.
are you ready
Yes, sir.
to get your question? Okay, then we get the mix done. It still selects the same last, so the before last. The question will be arterial and venous hyperemia, causes, mechanisms of development, manifestations, and consequences. Do you understand the question?
Yes, sir.
Then get ready, and we will soon get to you. And we continue with Shane. Please repeat your question and start the answer.
Yes, doctor. My question was causes, pathogenesis, and the main signs of gas and non-gas alkalosis and their importance for the body. So the causes of gas alkalosis is due to increased amount of oxygen in the blood. It could also be due to excess vomiting, which could cause electrolyte loss. We also have the overuse of diuretics. It could also be due to adrenal diseases and antacids. So the causes of non-gas alkalosis, we have loss that is due to any loss of stomach acids, then excess of antacids, then diuretics, and reduced volume of blood in the arteries. We have due to renal origin also, that is potassium depletion.
The causes are mainly correctly listed, but how about oxygen content in blood? I do not quite understand how oxygen influences acid-base state. Oxygen itself, while dissolved in water, does not change its pH, its acidity. What do you mean by oxygen?
So it's like in two forms, dissolved in the plasma and the red blood cells.
And how does it change the acidity of the blood?
The alkalosis. There is decrease in carbon dioxide on hyperventilation.
Those are two different things. Carbon dioxide directly influences the acidity of a solution, but the oxygen itself, it only slightly changes the buffer properties of hemoglobin. So the main cause, the main reason, will not be the oxygen itself, but decrease in carbon dioxide content that should be corrected.
So the pathogenesis of respiratory alkalosis, it is like due to decreased ventilation, it leads to the decreased elimination of carbon dioxide from the lungs, and also due to increased inhalation of carbon dioxide, we have acute and chronic.
Let's continue with the question. What else was listed there?
We have the main signs of respiratory and metabolic alkalosis. So the main signs of metabolic alkalosis, we have an increase in the pH, which in turn leads to the decrease in the amount of hydrogen ions. So there's a primary disturbance which leads to the increase in HCO3, and hence there's an increase in the pressure of carbon dioxide. Whereas in respiratory alkalosis, the pH increases, hydrogen ions are decreased. This in turn leads to decrease in partial pressure of carbon dioxide and decrease in HCO3.
Now let's discuss something that can be assessed more easily. For example, how does alkalosis affect the breathing rate?
There's decrease in the respiration.
Usually there is a decrease in respiration. How does alkalosis affect the pH, the acidity of urine?
There's a decrease. Consciousness also is decreased. We have a decrease in the blood pressure and as well as the heart rate, and respiratory rate also decreased.
There can be slightly parasympathetic effects, yes. So those
And in metabolic,
the main signs.
and next, should I go to the next? The importance for the body.
Proceed.
So the non-respiratory, we have their own defense against particular matter for the storage and filtration of blood for the systemic circulation. And also there's formation and release of substances under the alveoli and circulation.
So our main concerns will be the pH of blood, gas composition, and also as a secondary measure, the oxygen. And Spirit, yeah, you are correct. I think we've had enough of the answer, like I can see. And your presence marked on every one of our lessons, and we did on almost any lesson discuss with you the topics. So the whole cycle of lessons should be marked none less than a 5. That will be it.
Okay, thank you, doctor.
Next, we need to choose our a question to Ahmed Mahmoud. Is he present? Because I don't see any attendance from him on the lesson.
He changed the university.
So he will not be present today. Okay, and then we choose a question next for Mohammed Hager.
Yes, doctor.
Now let's do it. So for some strange reason now it did change the last question. So the question would be tumors, definition of the concept, and biological features of benign and malignant cause of tumors.
Okay.
Then now we proceed with Zaid with his answer. Please repeat your question and start the answer.
Hello.
Please proceed.
Yes, sir. My question is atrial and venous hyperemia causes mechanism of development, infections, consumption. So hyperemia is the increase of the blood flow to different tissue in the body. It can have medical implications, but is also a regulatory different tissue through vasodilation. So hyperemia, there are two types, arterial hyperemia and venous hyperemia. So arterial hyperemia is a typical form of violation of the local circulation characterized by an increase in the blood supply of the organ or tissue. Due to increased blood flow through the arterial vessels, aorta, arterioles, arterials, and arterial capillaries. Uh, the arterial hyperemia causes it's a physiological and pathological arterial hyperemia. Pathological arterial hyperemia is uh, is not adequate to the effect. It is not associated with a change in the function of the organ or tissue and plays a its adaptive damaging role. Is accompanied uh, accompanied by impaired blood supply, microhemocirculation, transcapillary exchange, sometimes hemorrhage and bleeding. Another is the cause of arterial hyperemia can have a different organ and natural. By the nature, the positive factor, arterial hyperemia is distinguished by mechanical, physical, chemical, biological, and social genesis. The first is like the mechanical, it's a effect. The physical, it's like a very high temperature, and the third is chemical. The fourth is biological, and the another is social. And the by original arterial hyperemia uh, is distinguished, the cause of which are endogenous or exogenous factors. So exogenous against that cause arterial hyperemia affect the organ or tissue from the outside. These include infections and non-infection factor of various nature. So endogenous factor leading to arterial hyperemia are found in the body. For example, the deposition of salt and constriment in the tissue of the kidney, liver, subcutaneous tissue, and the condition for the development arterial hyperemia. The site of action of stimulus, uh, the strength and duration of the action of the stimulus, the state of individual reactivity of the blood, the body, sensations of the body, the stage of autonomic nerve system.
I say we get some shortcut here, and we'll discuss the pathological role of arterial hyperemia. So, if there is already an increased influx of arterial blood into the tissue. What is the damaging factor here? How a tissue is damaged by the increase of arterial blood?
If there is a more blood flow, so there is a more blood pressure.
Blood pressure itself is not so destructive to the tissue. If the more blood pressure there is, the faster the blood will go through the vessels and the better supply of oxygen and nutrients will be conducted. But what are the pathological influences of increased arterial blood volume in the tissue? Why do we call it pathological? How it damages the tissue?
When excessive blood builds up inside the vascular system, the system of blood vessel in the body, blood occurs outside the vascular system due to the broken blood vessels and or injury.
First of
So
all,
as
they
hemorrhage,
can be a hemorrhage. As
yeah,
you call.
hemorrhage. It's a hemorrhage.
What else can happen in tissue when there is an increased arterial blood supply? Will there be some changes in chemical properties of the tissue? The main function of arterial influx is to supply tissue with oxygen and nutrients. And as for nutrients, there is never a situation when there are enough of them, but sometimes there can be dystrophies of excessive nutrients. But how about oxygen? If
Yeah, at
amount
the
of
pH
oxygen
level, it's like
is more than
increase, and
if
oxygen
there
level
is
is decrease.
if there is an increased amount of oxygen in the tissue, how can it damage it?
The more rupture, so it can be a
Now we do not describe the physical influence of excessive pressure. How about free oxygen that is not used by mitochondria? Is it good or is it bad for the tissue? This excessive oxygen.
it's a bad.
How does it affect the tissue? What is the damaging factor here?
Because the blood flow is increased, so the cells swell up.
The excessive amount of oxygen is a source of so-called oxidative stress. When oxygen is not used to oxidate enzymatically, it starts to oxidate substances chaotically, just by chance. And by doing that, there are some membranes damaged by free radical oxidation, by free oxidation. And by doing so, there will be the damage by excessive chemical reactions by excessive oxidation, and we call it oxidative stress. First of all, and secondly, not only a hemorrhage can occur, but if there is an increased influx of arterial blood, there is an increased pressure inside the capillaries, and there can be an increase of liquid, of fluid coming out of the vessel without rupturing its wall. And by increased amount of fluid, by swelling of the tissue, it can compress the neighboring tissues. So we call arterial hyperemia a pathological process, and it can cause damage, tissue damage on the tissue and on the neighboring tissues. How about venous hyperemia? We will not discuss now. We will not discuss the causes now, but how about its damage? How the venous hyperemia damages the tissue?
A decrease in the is a typical form of the local circulatory disturbance. The blood supply of the organ or tissue due to a decrease in the outflow of the blood through venous vessels.
Venous outflux is somehow blocked. Why is it bad for the tissue?
Shortness of breathing, less oxygen.
There will be less oxygen, but how does it happen? We call it hyperemia when there is increased amount of blood in the tissue, and blood carries oxygen. How can there be decreased
Evolution or obstruction of blood flow leads to an increase in the blood filling of capillaries. So for both capillary and venule.
The venous blood, as you say, does not contain much oxygen, and if that venous blood stays in the region, then there is no space for arterial blood to carry inside the new oxygen that is needed. So, as you say, venous hyperemia starts hypoxia. It is the main damaging factor. Now, let's discuss the primary signs of arterial and venous hyperemia. How does the area of arterial hyperemia look like? How does the site of venous hyperemia looks like?
Venous
There are signs by which we can detect presence of arterial or venous hyperemia, and we can differentiate them from each other. So, what are those simple signs of arterial hyperemia? What are those simple signs of venous hyperemia? If we just look at the tissue, sometimes we can say that there is a probability that arterial hyperemia exists there, or, for example, there is a venous hyperemia there. What are those signs? How we detect those pathological states? The simple characteristics of any event and of any tissue is its color, its size, and its temperature. How do those characteristics change in arterial and venous hyperemia?
Uh, the blanching of the organ, rise of temperature of the affected area, lowering of blood pressure in the venous of hyperemic area, pulsation of small vessels, redness of the organ, cyanotic shield.
I did not quite understand you. Let's try point by point. How does color of the region change in arterial hyperemia, and how does color of the region change in venous hyperemia?
The arterial have redness.
There will be redness in arterial hyperemia, and for venous,
The venous is like blue, or dark blue, or red thing.
there will be some bluish color to this region.
Yeah.
That's correct. As for size of the region of the tissue, how does it change in arterial hyperemia? How does it change in venous hyperemia?
The venous has the size is the bigger, and the arterial have more than bigger.
There will be increase in size in venous hyperemia. And as for arterial hyperemia, how it is there? Usually there is also increase in size, but if you compare increase in size in arterial hyperemia and increase in size in venous hyperemia, what will be bigger, arterial or venous hyperemia site?
Venous.
The more pronounced increase in size will be in venous hyperemia. Next, what about local temperature? How does it change on the side of arterial hyperemia and on the side of venous hyperemia? Does the local temperature change at all in arterial and in venous hyperemia?
The arterial hyperemia is the temperature is the high and the venous low.
The region of arterial hyperemia will be not exactly hot, but warm, and the region of venous hyperemia usually is colder than the other tissues. That's correct. And those are the main signs based on what we can differentiate them. So, as for attendance, we need a question about third lesson. What's about cell damage, adaptation, and metabolic organic disorders? Let's get some question out of there.
Doctor, can you repeat the question? I don't understand.
As for the question, let's discuss, for example, mutagens and mutations. The influence of mutagens on an adult organism. What pathologies can it usually create?
See the cells.
Please come again. I didn't hear you well.
Because if the damage, so there is a big size, the cell damage.
There should be cell damage due to mutagens and due to mutations. And as for the main types of diseases, the main types of damage, what is more important in mutagens influencing the adult organism? Usually, what types of diseases happen from it?
DNA changes caused by mutagens may harm cells and cause certain disease such as a cancer.
Please come again the next phrase. I did not quite hear you well.
I said DNA change caused by mutagens may harm cell and cause certain disease. It's a cancer.
The main problem in mutagen damage to an adult organism will be the carcinogenic mutations and start of cancer, of tumor growth. You are correct. So the genetic diseases are usually passed by the generations, but the mutagen itself induced on an organism usually causes tumor mutations in cells. So we should take it as the correct answer. And as for all tests, we should mark it as 4, I think. That's for your answer.
Okay, sir. Thank you.
Next, we will be presenting a question for Omar Ersa.
Hagar, tumor.
Before that, Omar Ersa, are you ready to receive your question? Okay, then we'll generate it. The question will be hyperthermia, hypothermia, the pathogenesis stages, and differences between fever and unadaptive hyperthermia. Do you understand the question?
Yes, doctor.
Then get ready. We will come to you shortly. And we discuss the question with Hagar. Please repeat your question and start answering.
Tumor definition of the concept and biological features of benign and malignant tumor. Tumor is abnormal mass in the body that grows due to the cells reproducing too much or not dying when they are supposed to. Tumors are classification benign and malignant. It's based to multiply characterize it. So we will talk about benign and malignant tumor difference. Causes of benign tumor. It's genetic or stress or environment toxic or exposure to radiation. Causes of malignant tumor, smoking and tobacco and virus or other infection, and diet or physical activity. And characterize of a benign tumor. It's a cell separated, not more separated, and not and the cell grows slowly. And it's then the cell didn't affect of or in the other organ. Malignant tumors cell can separate it quickly and can separate it via bloodstream or lymphatic system and invade the base of.
Please hold on a bit. I did not quite understand you. Do you state that benign and
malignant
do you
tumor?
state that benign and malignant tumors are caused by different factors?
Yeah, I said factor malign tumor. It can be smoking or diet or physical activity and virus or other infection. Benign tumor, it can be genetic, environment toxic, and stress. I said that, and I will talk about characterize it.
Before all the characteristics, I I would like to see the source that states that benign and malignant tumors are started with different causes. But now you proceed with your answer. What will you trying to tell next?
A difference between benign and the tumor and the malignant. Benign cells separated slowly and grow slowly, and it didn't affect in other organ. And the malignant tumor cells can spread quickly and usually grow rapidly. Um, and they can spread it via bloodstream or lymphatic system. Uh, and I will talk about malignant tumor development. It have stages. First stage is genetically stage is alerted epithelium cells, and the hyperplasia state cell divide more rapidly than normal, and the dysplasia stage is cell changes the form, and is the cancer stage. The cells stay in one place, and the malignant tumor. Cancer cells invite the normal tissue and enter the blood and the lymph system from the distant sites. Um, and etiology of tumors in general. Tumors occur when the cells divide and grow excessively in the body normal, and the body controls cell growth and division. New cells are treated to replace older ones or perform new function, and the cells that are damaged or no longer needed die to make room for healthy replacement. And stages, I say stages of malignant. Um, I will talk about uh, sarcogenic factor. Sarcogenic factor is roughly divided into environmental factor and genetic factor. Um,
I would like to know more about difference in
Okay, I will
factors.
talk about tissue like epithelium. What happened in benign and malignant? Benign have adenoma and papilloma, and malignant tumor have papillary secrenoma, and the mesenchyma in benign have fibroma and lipoma, and malignant have secroma. I don't know. It's enough.
There are many different histological types, but it is more interesting to pathological anatomy. As for pathological physiology, the more interesting is the mechanisms and the factors. And please, could you get us some information about difference of causes of benign tumors and of malignant tumors?
Benign tumor. Um, we can say about benign tumor development when the cell in the body divide and grow in excessive rate, and malignant tumor and benign tumor caused because genetic and stress and environment toxic and radiation. And in malignant tumor grow rapidly and invaded and destroy nearby normal tissue, and it grow if cell continue to grow and benign tumor can turn into malignant tumor if cell continue to grow and grown abnormally and separated abnormally, and 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 benign tumors stay the primary location without dividing other states of the body, and didn't spread to local structure or distant part of the body. And benign tumor are not usually problematic, and they can become large and compressed structure, causing pain or other medical complication. For example, lung tumor or and cause lung tumor cause difficult to breathe, and and tumors consist of the cell growth and morphological characterized growth whose growth and morphological characterized are markedly different from those of normal cells. We have increased cells proliferation and loss of definition, and infertile growth, and metasize to other organs. And the malignant tumor have five stage genetically stage. It's allergic to epithelial cells and hyperplasia and dysplasia and cancer and and the malignant tumor.
So
Enough.
there are different properties of malignant course of tumors, but if we get back to the cell damage, as we can see in attendance list.
Yeah.
So what are the main properties that differentiate tumor cell from a healthy cell? What needs to change in the cell
Growth.
so it
Growth. And we can know it by biopsy examination. It can malignant or benign.
in biopsy we see different types of atypism by size, by the number of nuclei,
Or
for example,
nucleus or size and the spreaded if the spreaded quickly or slowly,
by shape, by the type of growth, and so on. But what are the basic properties of a tumor cell that are contrary to the normal cell? Not in the biopsy, but in the process itself. What can a tumor cell do that cannot be achieved by any normal cell?
By shape and the number of cells and the size of cell and the division and the tumor abnormal mass of tissue and its growth and we can say rapidly divide and uncontrollably the cell in the cell.
So what do you mean by uncontrolled division? And how a division of normal cells should be controlled?
Should control the foreign cells and it divide by itself. Tumor cells divide by itself.
The tumor cell stimulates its cell's division, but no normal cell should stimulate itself to divide. And by what cells are usually normal cells stimulated for division? Usually those are immune cells that control reparation, for example, regeneration. But as you told, the main property of one of the main properties of a tumor cell is ability to stimulate itself for division. But it is not all. What else gives the tumor ability to grow in large number of cells? Not only cell stimulation on division, but also what?
For example, thymus tumor.
Any tumor and any tumor cell has this property. Not to divide.
Division.
But also to divide infinitely. There is no breaking point on tumor cells for division. They will divide infinitely, and normal cells of
Proliferation tumor is proliferation proliferation phase in tumor. It's quickly a cancer cell copies its DNA and divides into two cells. If the cancer cell will divide more rapidly, it means cancer. It's a rate of cancer.
The more rate of division is, the more probability that the tumor will be malignant, of course. Okay. So, two main properties: uncontrolled division and infinite division that comprise the tumor as it is. And how does how do the chemical properties of tumor change?
Chemical properties?
So there are chemical properties, for example, acidity, pH in the tissue. And is it different inside a big, fast-growing tumor than it is in normal tissues?
I mean the tumor's mutation and selection acting the individual in the population and the tumors involved by mutations and mutation acting on cell and the cause death of normal cell due to toxin and the inefficiency nutrients.
There is some damage, but how about energy supply to those cells? If cells are divided very rapidly, as you say,
Yeah.
then there will be deficiency in mitochondria. Not any of the tumor cells will receive a functional mitochondria. And if there are many cells without mitochondria, how do they get energy? And how does it influence the acid-base state?
By division. And it's anaerobically.
The energy is spent.
Anaerobically.
The energy is spent to provide energy for division, but the more rapidly the cells divide, the more energy they need. And as we said, the more rapidly they divide, the less they have the number of mitochondria. So they will get less energy by oxygen oxidating glucose, for example. So without mitochondria, what will be the byproduct of energy
it's singular mitochondria. It's higher animals would likely not exist because their cells would only able to obtain energy from anaerobic respiration. And in the absence of oxygen, a process much less efficiency and aerobic respiration.
So the main oxidation would be
And
anaerobic.
this causes acidly to the surrounding cells.
There will be excessive acid generated, and especially what acid?
Yeah, acid. Yeah.
Acid, but specifically what acid?
Lactic acid.
So there will be lactic acidosis inside the tumor. And how about the venous blood that exits tumor? Will there be some different in blood gases that get out of the tumor due to those changes that we just described?
It means
Some time ago, it was a way to find tumors, a way to diagnose the tumors. There was gas analysis of blood that comes out of the organ, and as we described the tumor cells and their energetic metabolism.
Hemangioma. It's begin non-cancerous tumor. It's made up of blood vessels. There are many types of this, like hemangiomas, and they can occur throughout the body, including the skin and muscles and bone and internal organs. And it increases erythrocytes.
Pivot to pathological anatomy.
And
Here,
it increases the erythrocytes.
The metabolical differences in tumor. So, we said that tumor has less mitochondria and has its metabolism primarily anaerobic. So, what will be the gas content of venous blood that comes out of a tumor if its respiration is primarily anaerobic?
filtrations. It's increased carbon dioxide level.
Carbon dioxide is created by oxidating glucose by oxygen.
Yeah.
And if we just mentioned that there is less oxidation in mitochondria, so where would this excessive carbon dioxide come from? If there is a primarily anaerobic metabolism inside the tumor, then how much of oxygen will be spent?
The oxygen will be by blood.
It's natural to deduce that there will be less oxygen spent.
Yeah, small amount or no oxygen.
Or we can say that the arterial blood that comes into the tumor exit it by the veins with increased amount of oxygen. And that was sometime a valid diagnosis test. So if blood that gets out of the organ still has increased amount of oxygen, then maybe there is a tumor inside there. Because, as we said, the tumor does not use up many of that oxygen because it is primarily anaerobic.
Yes.
That is one more difference in metabolical atypism. How about the interconnection between let's talk about interconnection between tumor and inflammatory and fever symptoms.
You need the symptoms of tumor.
Can they be generated by tumor, and what do those systems tell us about malignancy or benignancy of the tumor? The simple inflammatory symptom is an increase in erythrocyte sedimentation rate.
Yes.
And this type of symptom, is it more prominent in benign tumors, or is it more prominent in malignant tumors?
Cancer and between tumor and the immune system. This cancer make immune system weak by and spreading into the bone marrow, and it's the bone marrow makes blood cells that help to fight the infection, and they happens most often the leukemia or lymphoma, and but it's happened with other cancer too.
So if we see
and you need malignant.
If we see the increase in leukocyte count in blood, would we suspect
Malignant.
Benign or malignant tumor?
Malignant.
We will suspect that if it has some symptoms on the whole organism, it should be malignant, for example.
Yeah.
It is so for erythrocyte sedimentation rate. It is so for fever, for example. Slight fever also can indicate the presence of malignant tumor, and so on. So tumor, as we discussed, can be associated with changes in acid-base state, as we were going on your absent point. And it can be also connected with inflammation and with fever.
Connected with what? Formation and what?
And fever also, because any, especially malignant tumor, can have some necrosis and some immune cells activated, and by doing that, by activating immune cells, they can produce secondary pyrogens and stimulate some slight fever. And slight fever without any reason, without any infections, should be a sign for us to check that patient for some tumors too.
When the cells grow old or become damaged, they die, and new cells can take this place. And sometimes this orderly process break down, and abnormal or damaged cells. It is caused like necrosis, and cancer causes like weight loss and fatigue and fever, and may all go together and to cause of cancer. And the tumor can produce bio, can produce pyrogens cause an infection that produce pyrogens or interfere with the normal function of the hypothalamus. And cancer treatments may cause by a fever directly, and destroy white blood cells, and to make immune system weak, and making the more inflammation and infection. And the cancer, in rare case, present a great fever cause maybe signs of cancer. And a president of fever can be symptoms of leukemia or non hydrogen lymphoma.
All those signs that you listed, let's do not point on the exact place of the tumor, but can be analyzed to predict the occurrence, the finding of the tumor. How do we call that syndrome? That points on the presence of the tumor, but does not point its exact location. How do we call that syndrome? There are local syndromes, for example, neurological syndromes in tumors growing in the brain, or, for example,
Paraneoplasmic syndrome.
we call it the paraneoplasmic syndrome. Yes. So now we have discussed almost anything that could be connected with the tumor, so we need to end this examination. And now it was named, so shall consider this test as passed, and we continue with our next participant. But because before hearing out answer, we need to get some question to Timothy. So, Timothy, are you ready to receive your question?
Yes.
So, we change the question, and we see that the question will be: phagocytosis, its mechanisms, and importance in development of inflammation. Do you understand the question?
Yes, sure.
Then get ready. We'll proceed with you soon. And now we continue with Elsa.
Doctor, how I got the mark? What's my mark?
Ferger, your mark
Yeah.
will be 4 minus.
Okay. Thank you.
Next, Elsa, would you please state your question and begin the answer?
استاذ دكتور
Please go ahead.
Hepatinium is one's body temperature release above 36 36.5 and 37.5 degree. Hepatinium is one's body temperature above below 34.5 degree.
So let's discuss, for example, hyperthermia and increase in temperature of an organism. What main factors can cause it? What can be the reasons of hyperthermia?
Infection.
Sometimes temperature of the body increases because of infection. What we don't usually call it hyperthermia, we usually call it infectious fever.
Fever.
And later we will discuss it. But as for some other factors, what else can cause increase of the body's temperature?
The
I see your microphone disconnected, but I did not hear you well. Please.
okay. The fourth step. Numerous broccoli substance from outside the body exogenous of لا exogenous produce any fear the fever
Please excuse me, but your
psycho
microphone feeds,
psycho
your microphone feed does not conduct it well.
unit of gram negative gram negative bacteria with their their pathogenic components.
Please stop at this point. I'm afraid I cannot understand you at all. Your microphone feed continues to switch off, and I cannot understand the phrases.
You can write again. Doctor, write and send you answer. I write and send you answer.
Maybe we should continue in some different form, but before that,
Okay, you can write.
So we will continue with other participants, and when the final lesson ends with other participants, so we will try to get the way for us to communicate.
I can write and see you answer, and do you understand with me? Understand me?
I do understand that you want to have a test in a written form. We will discuss it after our other participants finish the test.
Okay.
For now, please stand by.
Okay.
Next. Next, we need to get a question for Abdel Rahman. Abdel Rahman, are you ready to choose the question?
Yes, sir.
Then we generate a new sequence. So the question will be the concept of pathogenesis, the main links of pathogenesis, vicious circle in pathology, and the concept of nervous influence in non-neurologic diseases. Do you understand the question?
Yes.
Then get ready. We will soon get to you. And now we need to discuss his question with Timothy. So please repeat your question and start.
It's about phagocytosis.
Phagocytosis and its role in inflammation and
The pathogenesis is the development of a disease and the chain of events leading to that disease.
Abdel Rahman, please stop here. We are now discussing the question with Timothy, and you will be next. Now, please.
Okay.
Now, please. And we continue with Timothy. So, phagocytosis. What it is, why it is important.
It's the process by which phagocytes, that is the neutrophils, monocytes, and macrophages, engulf and ingest foreign particles to help in eliminating them directly or acting as antigen-presenting cells for the specific or the delayed immunity of the body. So when we have for a foreign particle, the immune system reacts the immune activities causes the production of signaling molecules, that is the cytokines, which does attract neutrophils to the localized region, in the damaged region, that is. So the neutrophils first they phagocyte the damaging factor to destroy it. And when this can't occur, then the macrophages are now brought into the system. So that means neutrophils will occur when we have a minor injury, that is, like an immediate response. In case of an immediate response, then we have the release of neutrophils. But in case of a delayed type response, then we'll have macrophages and monocytes brought into the localized tissue. So they engulf the damaging factor. And in case this doesn't happen, then they act as antigen presenting cells. That's the macrophages, to be helped for specific immunity by the B and the T cells. So the B and the T cells will have the production of immunoglobulins, which will help resist or fight against the destructive pathogen. Or we can have the production of cytotoxic T cells by the T cells.
So phagocytosis is used to destroy, to get rid of damaging factor and to create a specific immune response to it.
Yes.
That's correct answer, and those are the main reasons for it to exist. Okay, it is a pretty straight answer to it, and also I have noted your absence on the first lesson, and the first lesson cannot be directly linked to phagocytosis, so we'll have some another question. For example, could you name the sequence of main stages of any disease?
Yeah, so the main stages of a disease can like the etiology or the incubation stage. Which one? The 4 stages of a disease, we have the incubation stage. That's the period between when the person first interacts with the disease and the occurrence of the first symptoms. Then we have the prodromal stage. This is the stage where the disease has begun, but not really clinically manifested, and it's symptom non-specific. Then we have the manifestation stage. This is the stage where the symptoms and the signs are shown, like it's symptom specific. And then you can have the outcome of the disease, which can either be complete recovery, incomplete recovery, which can lead to recurrence of the disease, or chronicity, and we also have death.
So those are the main stages and outcomes of a disease.
Yes.
Consider it a correct answer. So, as for attendance, it is all, and we discussed all the topics with you on the lesson, so there is no problems to give you a elevated 5 for this cycle of lessons. And it will be so. Next, we proceed with getting an answer. Now, first of all, getting a question for Ahmed. Ahmed, are you ready to
Yeah,
get
sure.
question? And then we generate it. Okay, then about pathophysiology. So the question will be pathophysiology as a fundamental science and academic discipline. The subject.
Number, which one? That one?
That is displayed in the formula box. Importance for clinical medicine. So the first one in the list, as we can say. Do you understand the question?
Question number 66, right?
Here you can see the list where questions are mixed.
Yeah, the physiological as fundamental science and academic depend, like, right?
With this random mixed, you got the question, physiology as a fundamental science and academic discipline. The subject and objective of pathophysiology, its importance for clinical medicine.
Okay.
Okay, then we proceed. Now, be prepared and we will discuss the question that was given to Abdel Rahman. Abdel Rahman, would you please repeat your question and start your answer? Again, Sakian, Abdel Rahman, Salah, Ismail, El Said.
Yes, sir. Yes.
So, will you please repeat your question for us and start your answer?
The main linkage of pathogenesis, it's the interlink of pathogenesis development of mechanism of damage. Every disease starts with the effects of the damaging environmental factor. Is the case of disease, which causes until damage to the body proteins leads to the development of subsequent damage mechanism. And in the focus circle, rapid break-up of their film after blinking. Their film instability leads to local drying and hyperosmolality of the epithelial surface. In turn, this leads to apoptosis, inflammation, and the loss of mechanoprotein goblet cells.
If I understand you correct, you state that any disease has its main pathophysiological mechanism, pathophysiological link, and it leads to other, more later links in a straight line. But is it always so? What do we call a vicious circle, circulus vitiosus?
Vicious circle in pathology In the Ficus circle, rapid breakup of their film after blinking leads to local dying, and hyperosmolality of the apical surface in turn that leads to apoptosis, inflammation, and a loss of mycin production, goblet kills.
I did not quite catch the beginning of the statement. So the epithelium can be damaged, and by doing so, it will reduce its stem cell quantity and its height, its thickness. But it is a gradual process. So there is damage, there is damage to the cells, there is decrease in cell count and in epithelium itself. But how it is a circle? For now, I can see only the straight line.
Again, doctor, don't understand.
I want you to describe some interactions that we call a vicious circle. The circle means that something that started continues and then gets back to its starting point. I did not quite understand how it is described in your answer. Please repeat or rephrase.
The script of Wigner's circle in pathogene is denotes a morbid condition in which cause and effect are so correlated that cause become effect and effect become cause.
As we told, the vicious circle starts somewhere in the pathogenesis, proceeds to some changes, and then returns to be its own cause. What example can you present for this type of interaction?
Example,
Please describe it further.
you tell example, doctor.
You stated that vicious circle in pathology is a situation when the one cause causes some effects, and those effects enhance, stimulate this cause, and it enhances itself through this circle.
Example, vacuous circle. Its line creates a vacuous circle as you have to keep telling new lies to cover the old ones. I was in a vacuous cycle when I was in debt. Buying on credit card was a cash advance.
Again, I could not understand you. Could you please repeat or rephrase some example of vicious circle in pathology?
The example of vacuous circle is poverty, and individual who live in poverty has no money to improve their situation socially or by education. They have no money to pay bills. Result.
So you provide an example of self-sustaining poverty as economical process and as economical effect. It is so, but how it is connected with medical pathology?
Has to connect medical what doctor?
Can you provide an example of medical pathological process that is carried out as a vicious circle? We did describe it on our lessons, I think more than once.
The vacuous circle medical a situation in which the apparent solution of one problem in a chain of circumstances created a new problem and increase the difficulty of solving the original problem.
This is the definition, but to be more specific, what examples could you provide of those?
Also called vacuous.
An example of vicious circle in pathology can be as follows. For example, in hyperthermia, there is an increase there is a dilation of subcutaneous vessels. But if there is a very hot environment, then temperature is more than temperature of the body, then those increased blood flow in the skin gets more heat inside of an organism, and the more heat inside of an organism exists, the more dilated will become the subcutaneous vessels, and the more they become dilated, the more heat enters the organism. So the later happenings support the initial pathological state. And this we can call a vicious circle. I just can radiation. What did it get? By name. I've lost that question. Oh, here it is. The concept of pathogenesis, main links, vicious circle. There is also the concept of nervous influence in non-neurologic diseases. How can you describe the influence of nervous system on the other somatic pathologies?
The concept of pathogenesis. The nerve is the brain, spinal cord, and the nerves make up the nervous system. Together, they control all the working of the body. When something goes wrong with a part of your nervous system, you can have trouble moving, speaking, swallowing, breathing, or learning. You can also have problem with your memory, sense, or mood. There are more than 600 neurologic disease major types in England.
Those are neurologic symptoms and neurologic diseases.
Mm-hmm.
Is there or are there some neurological changes in non-neurologic diseases? How does the brain and the nervous system react on the other types of pathology?
Pathology. Repeat, doctor.
For example, if there is a hemorrhage, then of course there will be decrease in blood pressure. The brain has its receptors for sensing the blood pressure, and the brain may get hypoxic damage because of it. So, how would the nervous system react to decrease of blood pressure?
How was nervous system?
What will be the changes in nervous system, and what will be the changes in all organism in its functions if there is a decrease of blood pressure?
During a short-term decrease in blood pressure, the opposite occurs, and the autonomic nervous system acts to increase vascularization, increase stroke volume, and increase heart rate.
How can we, in one term, tell about these changes? How can we describe these changes? Vascularization, increase of stroke volume, increase of heart rate, in one term. What is activated in nervous system?
Blood pressure is proctor reflex simulates the parasympathetic system, the business case relaxing of blood vessels, decreasing total peripheral resistance. It also decreases heart rate. As a result, the blood pressure comes back to the normal level.
So, in a reaction to decrease of blood pressure, in simple terms, the patient usually gets sympathetic activation, and by its effects, there will be continued blood flow, even with some loss of blood volume. So this is obviously the adaptive response, but this sympathetic stimulation, can it be pathologic to an organism? What harm can it produce?
The sympathetic nervous system will activate an increase in blood pressure by increasing the heart rate, causing the heart to contract more forcefully and constriction some blood vessels, which increasing the resistance of vessels.
The contracted arteria, how and why are they bad to an organism? What is pathological influence here?
What is pathogen? What?
You stated that sympathetic activation creates contraction of artery wall in every artery in organism. How can it be pathological? From one point of view, it is an adaptive reaction to increase pressure to stimulate circulation. But how the constriction of arteries can be pathological to an organism?
Conversely, parasympathetic activation leads to decreased cardiac output by decrease in heart rate, resulting in a tendency to lower blood pressure by coupling sympathetic inhibition and parasympathetic activation. The prophylaxis maximizes blood pressure reduction.
Sometimes after sympathetic activation, in some 20 minutes or so, there will be a parasympathetic activation too. But as for single sympathetic activation, how can it damage an organism? For example, the patient is prone to sympathetic activation, and if there is some chronic pain in him, then it will stimulate nervous system and stimulate this sympathetic response. Excessive sympathetic response and chronic excessive parasympathetic response, how can it damage the organism or its parts?
Organism.
Sympathetic activation increases heart rate and increases the arterial tone. And doing so, when heart needs to contract more times at a minute, and while it needs to perform more work in this increased arterial pressure, there will be a need for myocardium to adapt to it, and sometimes it results in myocardial hypertrophy. That is at first adaptive, but the later it gets and the more it gets, the more oxygen is needed by myocardium, and if it is not supplied, then there will be some symptoms of even insufficiency of oxygen supply, as we call it coronary failure or coronary disease. That is this is one example of this type of pathology. More than that, closed arteries, contracted arteries, conduct less blood. Even if there is some pressure inside of them, the less lumen, the less blood can travel through it in a time. So by stimulating heart and arterial vessels, there can be circulatory failure, circulatory insufficiency that will cause circulatory hypoxia in tissues. So maybe it is better to react to the pain by parasympathetic system. What can be the outcome of parasympathetic activation?
What can be what, Doctor?
Before we described, for example, pain that causes sympathetic activation. And it, as we said, can lead to circulatory failure. But if the nervous system reacts to pain by activating parasympathetic system, will it be okay for an organism? And what changes can happen if parasympathetic system is stimulated by the pain?
Sympathetic system. Physiological changes induced by the sympathetic nervous system include acceleration the heart rate, loading bronchial passage, decreasing motility of the large intestine, dilating the bubbles, and decreasing perspiration.
Usually won't die out of excessive bowel movement, but yes, parasympathetic activation also influences blood pressure, influences heart rate, and influences airway capability of conducting air. So even if we described sympathetic activation as pathological, the excessive parasympathetic activation also can lead to circulatory failure because of dilated arteria and decreased blood pressure and decreased speed of circulation. And also parasympathetic stimulation can lead to airway obstruction, as you said. So even the simple damage to single organs and systems can involve actions of nervous system, and by it can produce some secondary mechanisms and secondary symptoms that we call the nervous influence in pathology, and it has vast effects. That was as for your main question. Also, we need to discuss cell damage, acid-base state, inflammation, fever, and tumors. As for them, let me think for some questions. For example, in circulatory failure, in circulatory insufficiency, if there is less speed of blood traveling through a tissue, how will its acid-base state change? Will there be some changes in acidity, in pH, in such tissue?
What is the question, Doctor?
Another time. If it's a circulatory failure, that speed of blood flow in the tissue is decreased or completely stopped. How and why will pH in this tissue change? How will the acidity in it change?
Again,
Once again, if there is a circulatory failure, so if the blood moves slowly or does not move at all through its tissue, what will happen with pH in this tissue? What will happen with acidity in this tissue?
the circulation provide of the system. Circulation provides the production blood supply to all body tissues. It carries oxygen and nitrate to the cell and picks up carbon dioxide and waste products.
So the main point in what I am interested is the acid-base state of that tissue. Will there be changes in acid-base balance? And what will they be? Okay, or another question.
Doctor, you thought increase in blood carbon dioxide concentration leads to a decrease in blood pH, causing it to be acidic. The acidification results in release of oxygen from hemoglobin proteins. This causes decreasing affinity of hemoglobin molecules towards oxygen.
Is this excessive acid only from carbon dioxide?
And for example, the respiratory system and the circulatory system work closely together to deliver oxygen to cells and to get rid of the carbon dioxide the cells produce. The circulatory system picks up oxygen in the lungs and drops it off in the tissues, then performs the reverse service for carbon dioxide.
I will try to ask it again. Is the accumulating acid in that region only due to carbon dioxide, or is some else acid is generated there?
I don't understand this question.
Once again, you stated that acidosis happens when there is a circulatory failure, and it is due to carbon dioxide. The question is carbon dioxide the only acid that is increased in such tissue? Or is there some other acid that is generated when there is no blood flow?
The carboxyl increase through the biochemical reactions necessary for cell respiration, increase in metabolic activity within diseases result in the production of carbon dioxide as a metabolic product. Mm, what else?
The other important metabolic acid is lactic acid. And not only excessive amount of carbon dioxide is produced in the tissue where there is a circulatory failure, but also if the cells do not get oxygen and get only carbon dioxide, the cells oxidate glucose not to carbon dioxide but to pyruvate and then lactic acid. That was the point of the question. But we will try some other topics of missed lessons. How about fever? Why does it happen that in different patients and in different situations, a fever can be up to 38, for example, degrees, and in other instances, fever can be up to 40, for example, degrees of Celsius. Why does that temperature differ if the fever itself has similar mechanisms? So on what does this increase of temperature depend?
The mechanism involved in fever appears to be a defensive reaction by the body against infection disease when bacteria or virus invade the body and cause disease injury. One of immune system response is to protect pathogens.
So the fever is a reaction to pyrogens, but there can be a fever up to 38 degrees Celsius because of pyrogens, and there can be a fever up to 40 degrees also because of pyrogens. What's the difference? In what case there will be slight fever, and in what case there will be high fever? It depends on what?
Mm. that can cause high fevers. The most common case of high fever are infections such as pneumonia and meningitis and the infection of the urinary tract. A rare case fever can occur without any infection as a result of arthritis, lupus, or certain gastrointestinal and vascular disorders.
There are many different causes for a fever, but we group them all in one as pyrogens. But even in pneumonia, there are cases when fever is not very high, is sometimes 37.5, 37.8. And there are some cases when in pneumonia fever is high, up to 39 and even 40 Celsius grades. Why is it so?
The different its dangerous temperature are high grade fevers that range from over 104 to 107. Low grade fevers range from about 100 is intermediate grade for adults, but a temperature at which adults should seek medical care for an infant in 6 months. High grade fever range from about 103.
The damage
It's different.
to an organism will differ in slight fever and in high fever. But my question is about even when there is a similar source of pyrogens, pneumonia, why sometimes the temperature is high and why sometimes fever is not so high? The height of fever, on what is it dependent?
Pneumonia-derived fever can either be persistent or episodic with a tendency to rise rapidly. It may seem to go away before eventually coming back or be on the lookout for checking the kills as well.
As we told, the main reason and the main mechanism for fever is existence of pyrogens inside of the organism. But pyrogens themselves cannot reproduce and only influence the immune cells and the hypothalamus. So, if there is a small amount of pyrogens in organism, there will be slight decrease in fever, in its temperature. If there is a large amount of pyrogens in organism, there will be prominent increase of temperature. So, first of all, the height of fever is dependent on quantity of pyrogen, the amount of pyrogen in organism. And secondly, as we know, the pyrogen of bacteria does not directly stimulate hypothalamus. So, first of all, the main reaction on the bacteria is creation of interleukins by immune cells, the so-called secondary pyrogens. And if there is a normal immune response, then there will be pronounced fever. And if there is immunodeficiency, then the fever might be slightly lower, or it will not occur at all. So the height of fever depends on amount of pyrogen and on activity of immune system. Because of that, even due to pneumococcus, due to pneumonia, there can be different height of fever. Next, about absences. Then carcinogenesis. And we will discuss the biological properties of malignant and benignant tumors. Could they transfer into each other? Can a benign tumor become malignant? Can a malignant tumor become benign? What do you think?
What's the question?
Again, the question is as follows. Can a benign tumor become malignant? And vice versa. Can a malignant tumor become benign?
I can't hear, doctor.
I will repeat the question. There are malignant type tumors and there are benign types of tumors. Can they be interchanged? Can a benign tumor become a malignant one? Can a malignant tumor become benign?
Cancerous scale and lie dormant of year, but what triggers these scales to reawaken hasn't been well understood, but studies have linked chronic disease with cancer progression to investigate whether disease can awaken dormant tumor cancer research team led uh, by when reviewed the tumor release a large number of electrolytes including intracellular potassium and nucleic acid metabolites, all of which may under system calculation, and also most be benign tumors are not life threatening. Many types of benign tumors have the potential to become cancerous through a process known as tumor progression for the reason and other possible negative health effects.
I don't seem to get the answers out of you. Abdul Rahman, so today we will not consider this test as a passed, and we will arrange another test. So today I don't consider this as a viable answer. And after we finish with all the other participants, we will think about how and when we will have the next attempt.
Yes, sir.
Okay, so next we need to present a verb with a question.
Yes, sir.
I already selected.
Yes.
Okay, let's do it.
Let's go, teammates. If you want, if you sign like that, I'm relaxing.
I know.
Just
relax.
if I
So the question would be causes, pathogenesis, and main signs of, we already discussed alkalosis, so step back. The question will be pathogenesis, thanatogenesis, the dying, its stages, clinical and biological death, principles of resuscitation, its biological and socio-deontological aspects.
Okay.
Do you understand the question?
Yep.
Then get ready.
Okay.
For that, we will proceed with Ahmed.
yes, sir. Saleh Ahmed Muhammad Radwan, right? Start.
Please repeat your answer again.
No, I'm saying the name. My name is Saleh Ahmed Muhammad Radwan, right?
Let me check. Saleh Ahmed Mohamed Radwan.
Yes, sir.
Okay, please repeat your question for us.
My question was pathophysiology as a fundamental science and academic discipline, the subject and objectives of pathophysiology and its importance for the clinical medicine.
So describe
So,
what
first of
pathophysiology
all,
is.
okay, first of all, the meaning of pathophysiology is understanding the mechanism of a disease, and pathophysiology as a fundamental medical and biological science studying the general laws of occurrence, development, and an outcome of the disease. And the pathophysiology is also a science of vital function of sick organism, and it helps to diagnose and prevention, and it helps also to know the development of the disease and the stages of this, and help us to know the mechanism of development and outcome of the disease. So pathophysiology is a medical discipline that study the most general laws of occurrence, development, and outcome of the disease, and the biological process studies the principles of their treatment, as well as problem of methodology obtained to the disease of the pathogenesis processes, the knowledge, and it had stages, etiology and pathogens and outcomes, and about the subject and objective of the pathophysiology. Let's talk firstly for the subject. The subject pathophysiology is like a conversion of physiology and pathology and physiology, and it's a study of disordered the physiological process that cause the result or the otherwise associated with the disease or injury. And for the objective, we may say that the fundamental aim of domain of pathophysiology to unreveal the altered biologic which mean physical and chemical process in our organism that predict accompany or flow certain disorder of the disease. So finally, for the importance of clinical medicine, in many physiological is the base of the nursing practice, as it help building as like strong fundamental for nurses' main responsibility, such as ordering diagnosis, tests, and treating acute and chronic illness, meaning the medicators and managing the general health care and disease prevention for patient. And finally, about the stages of diseases, like we have 4 stages. The first one is incaption stage and prodromal and manifestation of disease and outcome of the disease. And that one that I forgot to talk about it. It's the disease occurrence. It has 3-way pathological reaction and pathological process on the inflammation, and finally for the pathological condition. That's all.
There can be different manifestations, but I heard a very strange statement. Does pathophysiology and knowing the pathogenesis is it needed only by nurses and nursing care?
No.
What about the general practitioners? What about therapy as a whole?
What? Sorry, about what?
Let us.
So you wanted me to talk about the importance of the.
What are the applications for pathophysiology? Of course, it is good to know the reasons, for example, etiology. But knowing is the one thing, and using it is another.
For diagnosis and for treatment also.
How do we use etiology for diagnosis? How do we use our knowledge on etiology on treatment?
Like it's how do we use pathophysiology in treatment? It helps us to diagnose the disease, like to know which disease is the patient has, and it's gonna help us for indicating the right treatment for determining the medicine.
If we talk about etiology, of course, if we know etiology, we can use etiological way of treatment that is directed on the cause of the etiology.
About the etiology, like etiology and therapy, and about the pathogenesis, it's pathogenesis therapy, and about the outcome. Am I right?
Pathogenesis, our knowledge of pathogenesis can be used, of course, in therapy as part of pathogenetic treatment. And what can you describe of use of pathogenesis in outcome determining? What are the
about outcome? It's divided into 2 parts, like the complete and incomplete. For the incomplete, we have sorry, somebody was calling me. We have the recurrence and become chronic. This one is due to this.
what is the difference in pathogenesis in disease that ended with recovery and in disease that did not end and became chronic? What
Sorry, I did not get the question.
you state that pathogenesis is important for understanding the outcome of diseases. And the outcome of diseases, as you said, can be
it's divided.
and can be chronicity.
It can be complete and incomplete.
What is a pathogenetic difference between, for example, full recovery and chronicity of a disease? What needs to happen or not happen in pathogenesis to achieve recovery or to achieve only chronicity?
Due to chronicity, the body cannot able to fight with the disease.
You may be correct. So the cyanogenetic mechanisms, the organism's reaction, is not sufficient to fully destroy the pathogenesis. And by that, disease becomes chronic. If body's reaction can fully stop pathogenesis, then there will be a recovery. You may be correct. And what else are we now and as usual forgetting? We did list diagnosis, we did list the treatment probabilities, but also knowledge about pathogenesis and so on. What is else the function of healthcare, and what should be done beforehand, as we can call it?
The prevention.
Of course, and how knowledge of pathophysiology can help us in disease prevention.
Like if we know the etiology, we can stop the etiology. For example, once we indicate it, we're gonna stop it.
Excluding the etiological factor, we won't even have a disease in the patient.
Yeah.
So we know that, for example, smoking is a viable cause for lung cancer. So stopping smoking prevents lung cancer to some amount, and so on. So prophylaxis, prevention of diseases, is also carried out by knowing etiology and also by knowing the pathogenesis. If we know what to stop in the pathogenesis, we prevent chronicity and lead the disease to the recovery, full or at least partial, and so on. Okay, that's for the role of pathophysiology. Next, for all our lesson course.
No, excuse me, sir.
Yes.
It's written on the table that I have absence for 4 classes, but I attend all. The problem is one thing. Sometimes I'm joining the class by using my PC. In my PC is written my full name. So sometimes I'm not using my PC. I'm trying to use. I was using my phone. So in those classes I was using my phone, but I did not understood that you was taking the absent by the meeting or anything like that. But if you checked once more, you will see that I attend all classes.
The downside of our style of lessons is yes,
I have sent you a message yesterday about that.
Sometimes it's difficult to strictly list the attendance, but if you were actually present, then
yeah, I'm sure about that.
Then, first of all, I have my proofs, and we can check them later. And if you are ready for a test today, then I think this won't be too bad if you try to answer for some more questions.
For me, it's okay. If you're gonna ask me now, it's fine. If you're gonna check, it's fine too.
So, not to have more time wasted, let's discuss some topics on
Okay.
hand.
Okay.
So, for example, what causes, what reasons do you know for gas type acidosis?
Hypoventilation.
Usually it is caused by hyperventilation, but not in any case. What else can cause gas type acidosis?
Maybe
Sometimes gas type acidosis is caused by increase of carbon
increased
dioxide
carbon dioxide, yeah.
in atmosphere, in inhaled air. But
Yeah, increasing
you are correct.
carbon dioxide.
Usually it is due to respiratory failure.
Yeah, it's like in conditions that occur when the lung cannot remove enough from the carbon dioxide by the body.
That is actually a definition
Like
of
it causes the pH of the blood and in another bodiless fluids to decrease, making them too acidic.
Of course. For the next question, what causes can you list for hyperglycemia?
Increase glucose in the blood.
Yes, what can cause it?
Lack of insulin.
Insulin insufficiency. What else?
The lack of insulin and excess intake of incos.
Excessive intake of sugars, of course. What else? Insulin isn't the only.
Maybe bacterial and fungal or an infection and cancer, and sometimes exposure to the certain medications.
Bacteria and cancer cells, usually they uptake glucose rapidly, and by doing that, the amount of glucose in organism usually decreases. So as for regulation, not only insulin regulates the glucose content in blood.
We may say about trauma and surgery and emotional stress and exercise, surgery.
What is common in these states? Why is there an elevation in glucose? What hormone mediates the stress itself?
Sorry, I didn't understood.
You listed trauma and stress.
Trauma because like stress
trauma and stress
capable of causing an acute leukocytes include the surgery, exercise, trauma, and emotionally stress, and other nominally etiology of the leukocytes include the certain of medications, smoking, absolutely, and chronic inflammation conditions. Am I right?
That all is different types of stress, if we can generalize it. But what is the mechanism of increasing glucose in blood in stress? What is the regulating hormone here? What is the hormone of stress? As it is
Sorry, for the last time, the mechanism of insulin.
Insulin, if stress will stimulate insulin,
like the drug phenomenon, people who have surgery in hormones earlier in the morning, whether they have diabetes or not. For people with diabetes, like blood sugar can something like dehydration deletes the water in the body, which means higher blood sugar concentration and
it can be a mechanism, but apart from insulin as a hormone that decreases amount of
insulin and glucose also.
Glucose in blood, there are hormones that increase the amount of glucose.
And cortisol.
Cortisol, what else?
Adrenaline.
Adrenaline, epinephrine.
And sometimes is let me think. And glucogen, sorry. I think, I'm not sure about glucogen.
The counterpart of insulin is glucagon, of course.
Yeah.
Glucagon. That we sometimes contra-insulin hormones are tyrosine and somatotropin. All those hormones, if increased in blood, also can induce hyperglycemia.
Yeah, sure.
But at least a few of them. I think that should be enough for Blitz questions. So we talk. Yes, reward.
Excuse me, sir, I can't hear you well.
So we will consider that you revoked your absence if it is if it did happen. If it did not happen, maybe now.
No, it's fine, but I'm sure about attendance. But it's okay.
Maybe now you know something better.
Yeah, it's good.
So as for today's test, you get 5 minus, and we will proceed with other participants.
Okay, doctor, thank you. May I leave?
Yes, you can leave if we are finished with you.
Okay, doctor, thanks.
Now, Kamrul, are you ready to receive your question?
Yes, doctor.
Yes, okay, we do a sort for one more time, and there will be the question. Hypoxia, general characteristics and definition of the concept, and the brief classification of hypoxic conditions. Do you understand the question?
Okay, doctor.
Okay, get ready and we proceed with upper bar.
Hello.
Hello, please repeat your question for us and start answer.
So my topic is thanatogenesis. So thanatogenesis is basically uh, clinical, clinical, or we can say like death. It is like biological, clinical, like process of death. The changes that we have in the process of death.
Could you please excuse me?
Hello, are you able to hear me well? Okay.
Excuse me. Now I'm ready to hear you.
So thanatogenesis. I'm going to talk about thanatogenesis and
And I've lost you.
1 minute. So
Mhm.
I'm trying to find my name. Where is it that I can talk? Yep. So I'm going to talk about thanatogenesis, stages of thanatogenesis, clinical and biological death, principle of resuscitation, and its biological and socio-deontological aspects. So thanatogenesis is basically uh, changes that we see clinically, biologically, and morphologically while during the process of death. So uh, the stages of thanatogenesis is are pre-agony, then there is terminal pause, then there is agony, then there is clinical death. After that, we have biological death. So, what is uh, pre-agony? So, in pre-agony, we can see the atrial pressure is like going down. Then there is loss of consciousness. Then there will be decrease in the metabolism. In terminal pause, we can see the atrial pressure and the breathing is reduced, and the function of the central nervous system is also very volatile. After
Before
that, in
terminal,
agony,
could you stop for a minute?
mhm,
Uh, if we talk about pre-agony, what
mhm.
is the main difference of pre-agony between pre-agony and the typical severe state of a disease? How do we differentiate them? What is the difference?
In pre-agony, serious state of disease may be it can be cured, but from pre-agony, we cannot cure the person as the blood pressure starts to drop down, and there will be loss of consciousness, as well as the metabolism of the basic components of our body will decrease. But in a serious condition of any kind of disease, it will not happen. So maybe there will be a decrease in the metabolism, but the atrial pressure will not fall, or maybe if the atrial pressure is falling down also, but the metabolism is not going to go down like that.
If it is fully unreversible, how they can exist people that were resuscitated, reanimated, and are living now? If you say that it is
For example, if a person is met with an accident suddenly, and after that is not breathing, the atrial flow has like stopped. uh, so we can regenerate the impulse from the sinoatrial node to to start like to do by doing CPR resuscitation, cardiopulmonary resuscitation, so that the person can start so that the blood pressure uh, go the blood pressure should maintain itself by circulation of by making the circulation normal.
So stages of thanatogenesis are not completely irreversible, but those stages cannot be recovered by organism himself.
I think in thanatogenesis, the stages of thanatogenesis, the organs start to fail slowly, but till the time they reach agony. Before that, it is reversible. But even in agony, there is a cessation of breathing, and there is a high chance of the person is going, or the patient is going to like go in further cessation of his life, or the processes is going under, for example blood, the circulation, and then there will be breathing, then there will be the metabolism that is going to cease, and all the vital functions that the body is carrying out is going to cease.
But there are some patients that even gone beyond that into clinical death. They were resuscitated and now are living and not dying permanently.
Yes.
So the stages of thanatogenesis are reversible, but they are not reversible by forces of organism itself. If there is immediate treatment, then we can revert thanatogenesis back to the illness itself. But if we just leave that patient alone, that thanatogenesis will surely progress. So that's the difference. There can be recovery from an illness, spontaneous recovery from an illness, but there cannot be spontaneous recovery from a thanatogenesis. There is our treatment needed, and it is emergently needed. It is as for principles. Next, as for CPR, in what cases it
my
is
internet is very laggy. I'm sorry, my internet is very laggy. Uh, in agony, further fall of blood pressure is going to happen, and there's going to be cessation of the breathing, and a sudden return to life, the last spark of life that will come. Steep reduction of all the vital functions after that is going to go down. And after that, we have clinical death, which is a cessation of the blood circulation and breathing. Then we have biological death, that is when the activity of the brain is completely stopped, as well as our heart and other organs stops working. Then we have after that there are so the cardiopulmonary is, so sometimes as you said that we can bring some people from even after the clinical death from to back to life by doing CPR, that is cardiopulmonary resuscitation. It is an emergency procedure that can be combined that combines chest compressions, often with artificial ventilation, in an effort to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in the person who is in cardiac arrest.
so. To be more specific, In what cases and with what indicators should we perform CPR? In what cases we should not perform CPR? The CPR is a procedure that is done just by itself. Nothing else is done with it. No, not always.
CPR is basically done when the heart stops, and this is the only criteria when CPR is basically done.
But if
CPR is done for cardiac arrest in order to oxygenate the blood and maintain the cardiac output to the vital organs, and uh, return back the blood flow to its normal circulating pathway.
So CPR is done when a patient has no heartbeat and has no breathing. And should not be done, as you say, if there is heartbeat and if there is a breathing, then it's agony and it should be treated differently. But how about the time of this stop of circulation? Is CPR needed if there is a stop of circulation for 1.5 hours, for example?
No.
So, what are the contradictions to CPR? When do we not perform it?
CPR generally CPR is done immediately, as it is an emergency procedure just after while we are having a surgery. If the patient is not responding, his heart stops and he stops breathing, we immediately go for CPR for 30 chest compressions, and after that 2 breathes on his mouth.
And if already some time passed, do we perform CPR, and how do we actually can differentiate what time passed after the stopping of circulation? What are the signs that it is?
If we do CPR for about 10 minutes and
10 minutes is slightly small threshold, but
30 minutes.
We usually do not do the CPR more than for 30 minutes, or sometimes if it is called for 40 minutes, but not more, because even with these measures, there won't be a live brain after it. But if we do not know for how time the heart stopped working, what are the main signs that it is already late? What are the main signs of biological death? The early signs of biological death?
For biological death, there will be no blood flow, and the patient is not going to breathe. These are the two main signs for biological death.
In clinical death, it is so also.
Oh, sorry, this is clinical death. Sorry. For the biological death, there will be the brain activity there will be no brain activity, as well as no circulation is already going on, and no breathing as well.
Usually, there is no electroencephalograph to register is there electrical activity of brain or no, especially not in a medical institution, but on the street, for example. How do you recognize the first signs of biological death when you should not perform CPR?
Can check the pupils as well as because the pupils are going to contract and contract and contract. It's not going to release in biological death because the brain activity is not working, and
do not contract. Pupils, if we press on the eyeball, they change their shape. The pupil of a person with a live brain will always be round. And if we press on, even if we press on an eyeball, but if we press on an eyeball and the pupil becomes changes shape to an oval and to a thin oval, then maybe it is biological death. Also, what can be the signs of biological death?
I can perform the CPR or not. Like, I don't know that he has gone into biological death process, but
of course, if you if you perform CPR and he
doesn't wake up, if he doesn't
life,
respond, there's no pulses on his arms and all, so we can see that.
Then of course it will be a sign that it is a biological death, but there are some other simple signs of biological death, and it is rigidity of muscles, it is decrease of body temperature, it is drying of the eyeballs, of the cornea, for example. It is the sign that is called the corpse spots, the algar mortis. Those are manifested after some time, after an hour, after 2 hours, and by them you should know that you should not perform the CPR because it's too late. It can be. So the presence of life signs is a contradiction to CPR, and the presence of signs of biological death is also a contradiction for performing CPR. And only if there are no life signs, but also there are no biological death signs, only then we perform CPR as it is. This is for thanatogenesis. Now we should discuss other topics of the lesson cycle. Could you please list for us the main stages of the inflammation?
Can you repeat the question again?
Could you list the main stages of inflammation?
Stages of inflammation. Excuse me. I don't actually get the question.
The inflammation as a
inflammation.
As a pathological process has its stages.
Inflammation. So there are 3 stages of inflammation. One is acute, then there is subacute, and the third is chronic.
Those are not actually pathophysiological stages. Those are types of outcome. Acute, that it ends fast, subacute, it ends not so fast, but it ends, and chronic, it continues through the whole life. But the three pathophysiological stages of inflammations are different and are described usually different. What are they?
Mm, uh, mm, uh, they can be alterative, exudate, and proliferate.
Those are the three typical stages of almost any inflammation. What are the main manifestations, main local manifestations of inflammation? And how do they arise? What is the mechanism? Sometimes you look at a tissue or at an organ, and you can tell just by looking that it is inflamed. What are those signs and how are they formed?
There will be redness due to the change in the microcirculation. Then
Not only change, but what
there will
happens?
be swelling
First of
and
all, about redness. It happens, and because of what it happens?
because of vasodilation and vasoconstriction. That is
Uh,
exudation. Exudation.
Vessels themselves are not colored by anything. The main color is brought to the tissue by erythrocytes, by hemoglobin. And
Yes.
if there are more hemoglobin, more blood in the area, then it will be reddish. Next, increase of size. Why and how it happens?
Uh, Increase of lymphocytes is it happens because to form an exudate and not letting the antigen to pass or spread more.
There will be some infiltration by leukocytes, but how about microscopic size of the tissue? Is it enlarged? Is it smaller than usual in inflammation?
Inflammation, there are stages in while formation of the exudate. As first we have the vasodilation, then we have the vasoconstriction, so that the antigen is going to be stored in one particular space while doing microcirculation in the capillaries, so that it should not spread too much around other parts of the body organs.
We will leave immune function and that at that, but how about simple manifestations? Again, while looking on the organ,
Mm-hmm.
to conclude that it is inflamed, should
Okay.
it be should it be increased in size or should it be shrinked, decreased in size?
Increased in size.
What is the mechanism? Why it is enlarged?
Uh, because due to the stimulation of the pain nerves, the swelling actually occurs.
Swelling occurs also.
I mean, in where the erythema occurs, the so due to the erythema that has occurred, there is a stimulation to the pain nerves, so this leads to swelling.
Uh, Nerves themselves cannot increase the size of an organ. The size of an organ increases because of what? Nerves themselves, they only conduct electricity, conduct activation, but they cannot ensure the enlargement of the organ. The organ gets bigger because of what? What is the mechanism there?
Because of increased blood flow, vasodilation of the arterioles, capillaries,
First
and
of
due to that, the hydrostatic pressure in the capillaries they increase.
all, the vessels dilate by themselves and get some size to the organ, but the main mechanism here is liquid deposition, is swelling because of liquid getting out of the vessels due to, first of all, increased pressure, and secondary, due to increased permeability of vessel wall. And this permeability is mediated by neural system and also is mediated by inflammatory mediators. Histamine, serotonin, and so on. So this is why inflamed region is enlarged in size. How about local temperature? Does it change, and
Yes.
why it changes?
It changes because there is a increase in the blood flow, and it will increase, not reduce, because there is already like the pressure is high, and the blood vessels have increased, the blood pressure has also increased, and as you said, the permeability and the exudation is also increased, so it is going to cause an edema.
Increased influx of blood can only hit the region of inflammation up to 37 degrees. But usually the inflamed region is at temperature like 38 and half, 38.5. So it is not only blood coming into the region that gets heat there. So there is some heat generated inside the area of inflammation by itself. And what do you think? How it is done?
Because the neutrophils and the eosinophils, they act upon upon the antigen, and due to the destruction there is a release of energy. So
There are many catabolic reactions occurring in the damaged tissue, so there will be some heat generated, of course. So that is a mechanism of heat generation inside the area, so there will be increase in local temperature. And now, how about the general signs of inflammation? Are there some symptoms that, or some laboratory values that can assist us in finding inflammations? How does whole organism change, and what can be the general symptoms of inflammation?
So the general symptoms of inflammation can be redness. Then it can be pain, swellness.
It is only for the local region.
Mm-hmm.
But if the organism as a whole would be red, we won't find the exact location of inflammation. So there are signs that can point us to the inflammation, but without actually showing us the region, the focus of inflammation. What changes in blood usually happen when there is inflammation in organism?
There will be increased number of eosinophils and lymphocytes as well as platelets.
Leukocytosis, sometimes thrombocytosis, but not usually. Also, what other characteristics of blood analysis can differ?
Then there will be formation of blood clots.
There can be stimulation of clotting, but it is not determined in blood as blood clots, and it is determined as, for example, hypercoagulation, stimulation of coagulation. Also, what about erythrocytes and their characteristics?
Erythrocytes will be trapped in the fibrin. Not trapped.
If there is an increased
toxicity, the erythrocyte count will not change, I think.
Usually not, but we also have a value that is called erythrocyte sedimentation rate. And how does it change in inflammation?
Can you repeat the question once more?
The erythrocyte sedimentation rate, ESR.
Yes, ESR.
How does it change in inflammation?
So the ESR will increase gradually because it's going to stick to, because the red blood cells are going to get stuck in the fibrins if there is a blood clot due to inflammation.
By influence of toxins and by influence of inflammatory mediators, erythrocytes lose their surface charge, and because of that they don't they can stuck into more compact parts, and by doing that they will be faster sedimented in laboratory case. And also there are different markers of inflammation, for example, C-reactive protein that is elevated in autoimmune inflammations, and so on. That was for inflammation. Next, we discuss some metabolism. What can be the causes of decreased protein content in blood?
Decrease protein content in blood. Malnutrition, then malfunction of the liver, or then the patient is suffering from nephrotic diseases, congestive heart failure, malabsorption disorders such as inflammatory bowel disease.
So the main points, the main of interest are intake of protein, inflammations, and
Proteins are not digested and absorbed properly if we have a problem in our liver or kidney.
digestion
So
failure, liver failure, or damage to the kidney can lead to hypoproteinemia, decrease in protein content. What would be the main damage to the organism, and what is so pathological about decrease of protein content in blood? How it affects organism?
so if there is a protein deficiency, then there will be degradation, as well as then we can see swelling, then we can see different severities of the infections, and the growth hormones are not going to work properly.
So, of everything that you listed, what is more dangerous? Usually, no one dies out of just swelling. So, what is the worst of that you listed?
That I listed. It would be degeneration, and there will be fatty liver and various kinds of infection. That is what I think.
Immunodeficiency, of course, can cause severe degradation in organism, but the worst
Even
is
the bones will be like not strong enough to hold our body, so it may get fractured. There is a risk to bone fractures as well, and the muscles are not even going to uh, like contract well, because there is a low intake of proteins.
but the most dangerous effect here is the lack of clotting function of blood, because
Of
if
liver.
there is hypocoagulation, then there can be massive hemorrhages that will cause, for example, hemorrhagic shock. And other effects of hypoproteinemia are also important. Immune deficiency, atherosclerosis increase, and so on. But the main problem here may lay in hypocoagulation and hemorrhagic syndrome. You do understand something about our topic, so we will consider it as a test with a mark of 4.
Thank you, sir.
And next we proceed to Kamrul. We have no people left without questions. So, Kamrul, please
Yeah.
repeat your question and start answering.
My question is
Doctor,
hypoxia,
how
general
give
characteristic and definition of the concept and classification of hypoxic condition.
Kamrul, please stop for a minute. Ersa, what did you want to ask?
Doctor, how much you give Mark?
Mark to whom? Ersa, if I understand you correctly, you are asking what mark I awarded, but to whom? I cannot hear you now, but I will disclose the marks after we finish. So, Kamrul, we should continue.
Okay, doctor. My answer is hypoxia. Hypoxia is oxygen deficiency at tissue level. And mild metabolic acidosis is relatively common in cases of hypoxia, and with severe hypoxia either in the setting of profound arterial hemoglobin denaturation and reduced oxygen content or poor perfusion ischemia at the global or local level. Metabolic and hypercapnic acidosis development along with considerable locate formation and pH falling to below 6.8. After that, there are four types of classification. First is hypoxic hypoxia. Second is anemic hypoxia. Third one is stagnant hypoxia, and fourth one is histotoxic hypoxia.
Please,
And classification of first one is, yes, doctor.
please describe the main mechanisms of those
Okay,
types.
doctor. And yeah. First one is hypoxic hypoxia. The partial oxygen of the arterial blood is reduced. And second one is anemic hypoxia. The arterial partial oxygen is normal, but the amount of hemoglobin available to carry oxygen is reduced. And third one is stagnant hypoxia. The blood flow to a tissue is so low that adequate oxygen is not delivered to it despite a normal partial oxygen and hemoglobin concentration. And fourth one is histotoxic hypoxia. The histotoxic hypoxia, the amount of oxygen delivered to a tissue is adequate, but the tissue cells cannot make use of the oxygen supplied to them. And characteristic of hypoxic hypoxia. Hypoxia is a low arterial partial oxygen and low percentage saturation of hemoglobin, low content of oxygen, low arteriovenous partial oxygen difference.
For now, we will not describe every one of them, but to get some understanding. As of those four types of hypoxia that you listed, hypoxic, anemic, circulatory, and tissue toxic. One of them can be local, and other of them are usually in whole organism. What do you think? What of them can be not only general, but also local in some region of body?
Stagnant hypoxia.
How can you describe its local type? How can it happen?
Maybe circulate hypoxia. Circulatory failure, hemorrhage, shock, and venous obstruction.
We usually describe shock as a systemic condition. So circulative hypoxia by shock would be in all organism simultaneously. But what pathological states can you remember that can cause only local hypoxia and local loss of circulation.
Hypoxia.
I did hear only the second part of the phrase. Please come again.
Anemic hypoxia.
If there is a decrease in hemoglobin
Abnormal hemoglobin
or its inability to bind with oxygen, then it will be distributed in all organisms. So I don't think that anemic hypoxia can be only on a local level. It will be in all blood, and all blood supplies all the organisms. So the single type of local hypoxia can be within circulation failure in some local tissue. For example, if there is a atherosclerotic plaque, then it can decrease the arterial blood flow in the myocardium, for example. And by doing that, there will be hypoxia in some region of myocardium, and there will be no hypoxia in other regions of myocardium and of body. And so it can happen in arteria of kidneys, for example, of adrenal glands, of bowels, and everywhere else. So circulatory failure can be not only general, but also local. And by it, there can be local hypoxia. And the next question for the understanding. Out of those hypoxias that you listed, we will repeat hypoxic, anemic, circulatory, and tissue type. What of them cannot be cured by oxygen therapy?
Could you repeat the question?
Once again, of those types of hypoxia that you listed, where we do not use oxygen therapy?
Tissue type.
We do not use oxygen therapy in the tissue type because there's no point. There is oxygen in tissue. The tissue just doesn't want to use it. Okay, that should be enough. But we've had your full attendance and even some discussions on the first lesson. So maybe it would be enough for the mark as low 4.
How much, sir?
Your mark on this test would be low 4 minus.
Why, sir? I answer all questions.
You did answer the main quantity of questions, but someone's not so specific as I wanted. For example, in discussing local and general hypoxia, you stated that anemic hypoxia can be local. And it is usually general, and only circulatory hypoxia can be local.
Local tissue hypoxia.
The tissue type hypoxia also is usually general, because the main cause of the tissue type hypoxia is intoxication, toxins. And toxins are distributed with blood to all organisms. So tissue type hypoxia is also usually general and not localized. So those inconsistencies in your answer result in mark 4.
Can you ask me one more question?
What for? I didn't. For more questions, it won't be fair as to other students. So as for now, you can accept this mark or decline it and try to pass this test at some later time.
How much I got, sir? Sorry, sir, interrupt you.
As for now, I am thinking of giving you low 4 minus on this answer. So, I cannot hear you. There are some sounds. Can you be close the discussion again?
I can't hear you very well.
So again, as for now, I will change the demonstration and we continue. So that is what I see for now, and that is what I want to register as a marks on this test. As for you, Kamru, what are your thoughts on this? So again, Kamru, should I register this mark as your final mark for this semester?
Okay, doctor.
So you agree with it? Okay. Next, Elsa, you wanted to ask something.
Yes, my topic is habitalium. Okay. Habitalium is one's body temperature leads above 36.5 and 37.5 degrees, and habitalium is when the body temperature above ضرب باله 34.5 degrees. Okay. And the generation of fever in the following stipulation. Fermi's. And
Let's try to.
bacterium from outside the body and exertions porogen in the fever akin introduction of gram-negative bacteria with the heterogenic with the borogenic compound wait polysaccharides is the most bound oxygen version, and the fever is a loss compound fission in the chicken without on infection for mechanism of infection for mechanism and happy superficie.
Would you please stop for now? And we will try to discuss it because I don't really understand you. So there is a state called hyperthermia. It is increase of body's temperature due to some external factors. And there is a state called fever.
Fever.
It is also a state with elevated body temperature.
Yes.
What is the primary and the main difference between them? In hyperthermia, there is increase in temperature of organism. In fever, there is an increase of body temperature. But why do we need two definitions of similar pathology? Or do they differ in some way?
Okay, difference between fever and hypothalamium. Fever is consent by increase in the hypothalamium set point with known as the body temperature as the body's abdominal response to the pathological ancest not above 14 degrees at temperature is sudden and unconditional increase in the body temperature.
Let's stop once again. As for temperature, there cannot be
yes, and temperature above 14 down to a following of the body's temperature mechanism.
There is difference in mechanism, but as for body temperature, there is no strict difference between hyperthermia and fever. Hyperthermia can be up to 42 degrees and fever also can be up to 42 degrees. What if there are differences in mechanism, then there are differences in treatment. How do we treat hyperthermia? How do we treat fever?
How what?
We are trying to compare hyperthermia and fever. And hyperthermia and fever have different treatment methods. What are they and how are they different?
Yes, hyperthermium is fever and the temperature contact by the increased in the hyperthermium. That bout loss known as the body temperature. Doctor.
I did not understand your answer. Again, maybe we should have a session of communication in some form of written chat. Maybe.
Hello?
No. Can you hear me now?
What, doctor? You cannot.
Again, Elsa, I could not fully understand you, so anything I can. I can propose a written form of a test. When I write you a question, for example, in WhatsApp, and you in live mode are answering that question because I cannot understand you.
Okay, you can write in WhatsApp. You give normal indicia.
I write up the question and you start to answer it. If I want to get something more clear, I get additional.
You can speak what number in WhatsApp I can send?
Okay, then please ask Disha to pass you my number, and we will try to get this done by written messages.
Okay.
We will compute on time and when we should do it. So this is the outcome of our final test. I will get a shot of it now for Disha. So, are there any questions for me now?
Doctor.
Yes, Abdullah.
Didn't get degree, doctor.
I found your answer unsatisfactory, not on the primary question, not on the secondary questions where you were absent. So we should,
doctor.
So we should decide for ourselves when we meet again and.
Doctor, I absent to lesson.
If you want now to compare the presence proofs, we can do it now. And would you like to do it? Would you like to see the Attendance fixation shots.
الدكتور
There was some static. I did not understand you. Again?
what do you say? What do you want to say?
So, now, would you like to see the shots on what I registered